Hello, everyone. Good morning, good afternoon, and good evening, depending on from where you're joining us today. My name is Ashima Sinha. I'm a research scholar in the Gender Equality and the Economy program at Levy Economics Institute and co-chair of IFA's online event committee, along with Mary Borroman. On behalf of the Online Events Committee, it is my great pleasure to welcome you all to our event, Advancing the Landscape of Research, Methodology, and Data on the Care Economy, a Feminist Economics Lens, co-hosted with the Levy Economics Institute. Before we get started, I wanted to provide some friendly reminders for you all. Today's event will run for 90 minutes and will be recorded and posted on IFA's YouTube page afterwards, where you can also find our past online events. As this is a Zoom call and not a webinar, a very friendly reminder to please keep yourselves muted. After a brief introduction of the event and the panelists, we will have the panelists speak for the next 50 minutes, followed by which we will have a chance for Q&A, so feel free at that point to put your questions in the chat or use the raise hand function, and our committee member, Michaela, will help moderate those questions. The event can also be interpreted in Spanish, and you can pick your preferred language from the globe function at the bottom of your Zoom screen. Today's event, I want to mention that it's part of a two-parts, it's one of the first part of a two-part series on the care economy, the second of which will be on care policy tools and initiatives with leading experts from the International Labour Organization, UN Women, and academia. Today's event will bring a focus on the care economy to the Online Event Committee's Research Method series, which aims to cultivate dialogue on aspects of data, methodology, and methods that are useful for conducting rigorous feminist economics research. Turning a bit to the framing for today's event, feminist economists have long emphasized the central role of the care economy in advancing not just gender equality, but also sustainable and inclusive development. As momentum on the care economy has increased globally, it is very crucial for us to continue grounding our research and policy engagement with rigor in feminist economic theory and research methods, which in turn is extremely imperative for greatest impact. As we consider how to meaningfully accelerate progress on the care economy at the global level, aligned with the popular 5R framework, that is to recognize, reduce, redistribute, reward, and represent care work, the goal today is to bring together experts who can offer insights across the domains of research, methodology, and data. Today, we will hear from pioneers and experts in the field to take stock of where things stand, identify key challenges, and reflect on opportunities to continue advancing impactful feminist economic research on the care economy. We have two sub-themes for today. The first will focus on research and methodological progress, where we will be highlighting the notable advancements in research and methodologies associated with integrating care work, both paid and unpaid, into economic analysis. The second segment for today will focus on data infrastructure and services, assessing developments over the past 2 decades in time use data, surveys, and broader care data systems, including care dashboards. Finally, it's my honor to welcome and introduce the panelists for today's event. The research and methodology section will feature Ajit Zacharias, Senior Scholar and Director of the Distribution of Income and Wealth Program at the Levy Economics Institute. Thomas Masterson, Senior Scholar and Director of Applied Micromodeling in the Levy Economics Institute's Distribution of Income and Wealth Program. He's also the Director of Graduate Programs at Levy Institute. Özlem Onaran, Professor of Economics at University of Greenwich. For our data infrastructure and survey, we have Nancy Folbray, Professor Emerita of Economics at the University of Massachusetts Amherst and Director of the Program on Gender and Care Work at the Political Economy Research Institute. She's also a fellow at Levy Economics Institute. Misty Hedgenes, Associate Professor and Associate Research Scientist in the Institute for Policy and Social Research at the University of Kansas. Maria Floro, Professor Emerita of Economics at American University. Thank you all for being here and welcome. I will now pass on to our first speaker for today, Ajit Zacharias.
Thank you. Thank you, Ashima. Thank you, IFA, for organizing this event. And I'm honored to be here with the distinguished colleagues and panelists here. My 8 minutes I would like to devote to sharing with you a brief overview of the work I've done with my colleagues at the Levy Institute and elsewhere on integrating household production into the analysis of household economic well-being and household economic ill-being. By household production, I mean the production of services for own use that falls outside the SNA production boundary, such as cooking and caring for dependents in the household. The work on economic well-being focused on developing the Levy Institute measure of economic well-being, abbreviated as LEMU, in the early 2000s. Conceptually, we thought of economic well-being as the command or access the household exercised over products resulting from the social production process during a given period, usually a year. Naturally, such a concept made the incorporation of household production necessary, since these activities directly contribute to household members' command over product. We also have to consider products emerging from the monetary circuit in a capitalist economy. Commodities, that is goods and services exchanged for money, the access to which is generally mediated by the markets. Also, items that are not exchanged directly for money, but fall within the monetary circuit, which are generally provided by the state, for example, public K-12 education in the United States. The magnitude of the command or access is approximated by an income measure. Specifically, the LEMU is calculated as the sum of what we call base income, which is primarily labor income, income from wealth, then net government expenditures, which is a measure of the net benefits received from the state, and the value of household production. What makes the LEMU unique is the integration of household production into a comprehensive measure of economic well-being, rather than, say, just adding the value of household production to household money income. Let me illustrate perhaps what I mean with this figure. Ashima, if you can show that. Okay. So the information in the LEMU database allows us to develop a class schema based on wealth holdings and people's position in the social labor process, or occupational class, to put it more simply. Now, in the chart, we are using a binary version of that schema with working class households and non-working class households. The latter consists of the capitalist class, the managerial and professional classes, and the incorporated proprietors. We use the standard growth accounting formula to express the annual percentage change in LEMU. That's the number shown at the top of each bar. Now, the contributions of each component of LEMU are expressed in percentage points, and they are the bar stacks beneath each of the numbers, right? Now, we can look at the impact of the initial shock of the COVID-19 pandemic on the right-hand side panel, 2019 to 2020. Excuse me. Okay, I thought I heard something. Was it anything to me, or was it just a random noise? Okay, all right. So it seems that net government expenditures were by far the principal positive contributor for the working class, and income from wealth was the main positive contributor for those not in the working class. The value of household production played almost no role for the working class in terms of the change in Levy between the 2 years, and a relatively larger role for households not in the working class. The reason for the rather small role of household production in that change between the 2 years is the small change in the average hours of household production. Our work on integrating household production into poverty measurement began about a decade later after the LEMU. We took the crux of Claire Vickery's 1977 critique of the US government's poverty thresholds as our starting point. We reframed that critique as pointing to a logical inconsistency in the official procedure for ascertaining who is poor. The thresholds implicitly presupposed that someone in the household had enough time available to perform household production. but the measure of resources ignored availability of time. Recognizing the time deficits in household production reveals that the official poverty rates understate the extent of economic ill-being. The other conceptual modification we made was to consider individuals' time availability rather than the household's time availability as a whole. What this allows us to do is to explicitly link the gender disparities in household labor to poverty status. Let's consider, for example, next slide, please. Let's consider, for example, the potential of redistributing household production responsibilities to reduce consumption poverty in sub-Saharan Africa. We report statistics in this figure for those who are time poor in the baseline scenario. These are heterosexual couple households with at least one working age employed person. What the bars are showing are the share of households in our sample below the consumption poverty threshold for each country using alternative poverty thresholds. So the official poverty, the set of bars that correspond to official poverty, they refer to the official poverty threshold used in that particular country. Time-adjusted poverty refers to the official poverty line adjusted for the monetized value of time deficits in the baseline, right? The other bars correspond to different scenarios of redistribution of the total time required for household production. So we are redistributing the total household production time across its members. And we use three different scenarios here. One which we term equal shares, or like a naive egalitarian schema, which means that there is equal division among the working age members of the household.
Ajit, you have 1 minute left.
Sure. So the time available uses the time adjusted poverty line when the division is according to the time available to the individual after setting aside a certain amount of time for personal maintenance and the actual hours of employment that the person is engaged in. And the opportunity cost refers to our familiar Beckerian way of valuing household production time and the distribution according to that, what the relative opportunity costs are of time. Now, two findings stand out. First, note that all the redistribution bars are lower than the time-adjusted poverty line, but above the official poverty line. So redistribution can go a long way toward reducing the impoverishing effects of time deficits, but it will not eliminate them altogether. Second, redistribution according to time availability of individuals has the most poverty-reducing impact. Let me conclude by saying that there is a lot more work to be done on integrating household production into economic analysis. We are grateful for the support that we have received for our work from the IFA community. Thank you very much.
Thank you, Ajit. Thanks for wrapping up. Tom, you'd be next.
Tom, you're muted.
Hi again. I'm Tom Masterson. I just said thank you, IFE, and mentioned that I've been implicated in some of this work over time. I wanted to briefly mention, some related work to what I'm going to talk. I'm mostly going to talk about the Levy Institute micro simulation model as it applies to care work. But there's been a lot of other work done by our collaborators, especially İlkaracan, her work on the purple economy, especially in Turkey and Jordan. Jerome Behano and Susan Himmelwhite have done a lot of work in the UK. Maria Floro has run this program at American University. And Islam and Jem have done a lot of work as well. Of course, you'll hear from Islam soon. And of course, our colleagues Rania Antonopoulos and Kijong Kim have done a lot of work on the macro impacts over time at Levy. But so I'm going to talk about this, which is not so much a model as a collection of methods, but we'll call it a model for now. We originally developed it to simulate the employment and earnings impacts of the American Reinvestment and Recovery Act in 2009, the signature of fiscal policy for Obama's first term in office, basically just assigning jobs to people. And we adapted this as we started to do estimates for the LIMTIP to do some estimations of what impact employment might have on time and income poverty. We've later incorporated a macro policy module to kind of drive an actual policy impact as opposed to just kind of assigning jobs randomly, but I'll talk about this more later. So a SAM or an IO model for macro impacts, employment multipliers, and then now we're working on a macro-micro model that incorporates the stock flow consistent macro model that Levy also pioneered, and a social accounting matrix, and then a micro simulation of the employment impacts and the time and income poverty impacts. So stay tuned for that. So the LIMTIP employment simulations, what we've done was, using the base data sets for our time and income, time and consumption poverty measures, we would ask whether an income or consumption poor household can escape poverty via employment, right? So in a sense, this is a test of the inclusive growth hypothesis of poverty alleviation. And based on current labor market situations, so based on data sets that are currently available for the country, we look at all eligible adults, so adults, working age adults that are not retired, not in school, not physically disabled, and we assign the likeliest jobs to them and see what happens. And what we find was many poor households don't have any eligible adults. In other words, in many poor households, all adults are already working. So nonetheless, in the households with eligible adults, you would see some decrease in income and consumption poverty, although not all of them would escape income or consumption poverty by finding the jobs they're most likely to get. But an increase in time poverty usually comes along with that. So the micro simulation that we've done has based on some macro level policy impact, so what we try to do then is estimate and simulate the changes in employment based on that policy change, and then simulate changes in time use. And then we can recalculate LIMTIP and LIMTCP with the new earnings and time use. And so this breaks down into different effects of the policy, the direct effects of the policy on time use. So for Korea, we estimated the impact of childcare subsidies and their uptake on time use. In Ghana and Tanzania, we modeled two investments in social infrastructure, road repair, so the reduction in commuting time especially is important in these two countries, and early childhood education, so basically having younger children in school. And then in Mexico, there are a set of three policies we looked at for which we didn't do the macro part, but we did the micro part. And that was early childhood education, so expanding early childhood education in Mexico, full-time school day, so having kids stay in school until the end of the workday, and then universal elder care, so which is kind of everything that falls under an elder care. The indirect effects then have mostly to do with employment. And so because of the investment, you have an increase or a change in the structure of employment. So in Ghana and Tanzania, in Turkey, we did this. In Jordan, we've done this, and in Mexico. So in each of these cases, one of the policy changes was expanding early childhood education. In Ghana and Tanzania, and in Mexico, there were additional policies, as I mentioned already. So the total effects then on time and income poverty, it's the direct effect of the policy on time use, which is some reduction in time use among household members. Employment effect on earnings, which is important for reducing income or consumption poverty, and the employment effect on time use. So because people are getting jobs in the households that are directly affected, we re-estimate the shares of time use among people within those households. And so we recalculate the time and income poverty or time and consumption poverty measures in those cases. The main obstacles to the research, I think, are lack of evidence on the direct impacts of policy. So the direct effects that we calculated are, in some cases, stretching the available evidence.
Tom, you have 1 minute left.
Yeah, thank you. This is the last slide, I think. So they're kind of stretching the available evidence, and the impact of road repair on the time use of affected individuals is difficult to measure, and there's not a lot of evidence we can draw on. So we have to make some heroic assumptions to calculate it. And then changes in engagement with employment is perhaps a little easier if we're expanding an existing policy and we can kind of leverage the existing structure of employment and the policy. So we need more direct evidence in a variety of contexts, high income, low income, middle income countries, in order to do more of this work. So that's what we'd like to do. So that's it for me. Thank you very much.
Thank you, Tom. Thank you very much. Özlem, you would be next.
Excellent. Thank you, Ashima. Thanks to Yafi Online Seminars Committee for organizing that. It's really great to be able to come together effortlessly without any CO2 emissions. I love this series. I will build on the work that we have been doing at the University of Greenwich with my colleague Cem Oyvat and former colleague Eurydice Fotopoulou, take stock of the gendering macroeconomics efforts that's now dating back to 30 years and moving forward. And I want to ask in this audience of feminist economists, why bother? What is in it for feminist economics, for feminist economists to try to work with macroeconomic modeling? And I will build on the feminist post-Keynesian, within post-Keynesian, a post-Kaleckian trend that has been doing work to integrate gender and the care economy into macro models. Why should we bother? I think the thing that motivated me and my colleagues most was to provide rigorous analytical framework and evidence to fight fiscal conservatism in defense of public social infrastructure investment, to make a macroeconomic case for that. I'm sure we all think there are many evils in the world, but from where I stand, the narrow researcher mind, the worst evil in my world is this fiscal conservatism. So how can we defeat that fiscal conservatism and show that we have to invest in public social infrastructure? And we can do that. Yes, we can. There is money to do that. So this feminist macro post-Keynesian, post-Kaleckian models are in the family of demand-led growth models. What feminists bring into this literature is also integrate an endogenous supply side in terms of both labor supply, but also technological change, that is labor productivity. In the spirit of demand-led models, obviously demand-side constraints matter because economies are operating with excess capacity and involuntary unemployment. And this might sound obvious to a lot of the heterodox economists, but it is not at all obvious to most mainstream trained economists sitting in the ministries of finance, playing with their CGE and DSGE mainstream models. So in that demand side constraint model, what the government does, what the public sector, public spending does is crucially important. It will have multiplier effects. And actually, the different types of public spending, whether it's in purple care, public social infrastructure sector, or in manufacturing or construction, say providing inputs to the green economy or other types of physical infrastructure, those multipliers will be different. But what matters is that the care economy, public spending, is a crucial driver of the economy on both the demand and the supply side. So care economy is a key sector, just as you would think of industry, manufacturing industry, to be a key locomotive driver of development in the tradition of old school development economists. So on the demand side, we have multiplier effects, but then those demand side effects do have effects on the structure of income and wealth distribution, as well as the structure of employment. On the supply side, what the government does and the spillover multiplier effects of these on demand does have effects on labor productivity in the rest of the economy, and it has effects on the labor supply of men and women. What feminists contribute to this model, beyond integrating the care economy, demand and supply side effects, is also the integration of gendered social norms, which lead to a certain gendered division of labor, and that comes with behavioral differences, say, among women workers versus men workers in terms of how they decide to consume out of their income. These are having then crucial macroeconomic outcomes. On the distribution side, again, understanding gendered and racial profiling of jobs is very important if you want to have an endogenous analysis of wage bargaining, wage determination, and in turn, distribution of income and wealth. This family of feminist post-Keynesian macroeconomics do embrace the dual effects of wages, both as a source of demand, but also as a cost item. And they do understand that what happens to gender gaps will have then very crucial effects on distribution, demand, and supply side productivity effects. So maybe one crucial thing to dig deeper here is the productivity behavior. We model that as an endogenous technological change process where changes in wages, changes in output, as well as public investment in both the social and physical infrastructure, together with private investment, but also household behavior in terms of spending in market provided care services or provision of unpaid care labor, all have crucial effects on productivity. In that sense, the model is embracing the feminist idea that public care spending should be redefined as social infrastructure investment because it does both direct and indirect impact on productivity. Now, this is not unimportant from a macro aggregate business case thinking perspective, because public care investment has dynamic implications for unit labor costs of the economy, which in turn is important for private investment behavior because it does feed into profitability. It
Özlem,
does
you
feed
have 1
into
minute left.
exports and imports and relaxes balance of payments constraint. So one crucial finding is that the multipliers are gendered, but they're also large. And care multiplier compared to other types of public investment multiplier are the highest. They have very strong effects on the demand side as well as the supply side on productivity. This stands for both emerging middle income economies that we have worked with, as well as high income economies such as the UK. Those strong effects, multiplier effects, feed into both private investment and consumption effects, and they also have lower import dependency, thus they are better for net export stimulation. In terms of the composition of consumption, the effect isn't just on the level, but public care infrastructure spending means it leads to more income in the hands of women, and it does stimulate further health, education, nutrition outcomes within the household. Uh, and if you look at the employment effects of care stimulus,
Sorry to interrupt,
employment
Özlem.
of
Okay.
both women and men increase despite very high productivity effects. So I'll conclude by saying fiscal policy is the biggest equalizer and most effective for employment generation. And it does partially fund itself because the multipliers are high. So there is money, and there were some results to share with you, but I'm out of time, so I'll stop here. Thank you for your patience.
Thank you so much, Özlem, for wrapping up. Thank you. And this was great. We'll quickly transition to the data, infrastructure, and survey group now. Nancy, you will be the first speaker.
Hi, let me just pull up my PowerPoint, which seems to have disappeared. Okay. Thanks so much for organizing this, and those of you who are participating in it. It's a really important discussion, and I've really learned a lot about it, a lot about this topic so far. I just want to start by saying I have a slightly different take on the issues at hand. I agree that household well-being is really important. And I'm also really interested in the macroeconomic effects on gross domestic product and growth. But I think of that of care work more in terms of its contribution to the production and development and maintenance of human capabilities, which are kind of a public good. And I think that makes a really strong case for overcoming the kind of fiscal conservatism that we're really trying to resist. But it also puts us in need of better data to construct this argument. And in the literature on care work, there's a lot of enthusiasm for time use surveys that I think needs some critical reexamination, that we need to pay more attention to some of the limitations and discrepancies in survey design. Most existing surveys aren't effectively measuring secondary activities and responsibilities. And more importantly, we don't really know how time use is interacting with income, with consumer expenditures, with consumer durables, utilization of public transfers, and so forth, to affect the productivity or the success of what households are actually producing. So I'm increasingly unhappy with just using a simple replacement or opportunity cost measure that's a market-centric measure of what's going on in households, rather than trying to really look at the larger social outcomes. You know, fundamentally, I think there's a tension in economic theory today about the relationship between consumption and investment. And in general, spending on people and on children and elderly and so forth is put into this category of consumption, when in fact, even sort of neoclassical theories of human capital emphasize its investment components. And by enlarging the human capital metaphor to think about human capabilities, which is a much larger category, I think we can really emphasize that it's an investment that offers both private and public returns, looking at the actual output rather than just the inputs that go into this. So let me just give you some reasons why this matters. There's very little attention, even in data-intensive affluent countries like the US, to the private costs of investment in children because it's treated as consumption rather than investment. So in the US, it's the US Department of Agriculture that has periodically published estimates. They're very limited, they're very out of date. The latest are based on 2015 data. They grossly understate the actual time costs of raising children as well as taking care of other household members. And I've just written a blog post laying out some numbers showing that the actual total cost of raising children in the US is about twice as high as conventional estimates suggest. And here's the URL where you can look at the gory details if you like. The reason that it's important is that it shows how public contributions to households in the form of child allowances or other pro-child or pro-care policies are very, very small compared to the private costs. Also, this issue of measurement really affects the technical issue of equivalence scales, which are the adjustments that are made for differences in family size and composition. And these equivalence scales come up in official US poverty lines and supplemental poverty thresholds, in poverty measures in other countries. And they also come into play in estimates of the LIMTET, looking at how household composition affects relative household needs. So when we underestimate actual expenditures on dependents in the household, we're engaging in sort of complicity with very misleading tax rates and misleading calculations of what eligibility for public benefits really should be. So I think that's why it's politically very important and very, very important to the policy space. So in the US and in other countries, inflation has become a really pressing issue. And if you look at the consumer price index that's relied on as a source of data for measures of well-being, it's very misleading. It's based on a basket of consumer goods, but when people can't afford to buy certain things like houses, those price increases just don't show up in the CPI. Most of the costs of owning a home are not included in the CPI because these are considered investment rather than consumption. Ironically, investment in a house, spending on a house is investment, but spending on children is just consumption. And basically, we need to have a separate consumer price index for households who are caring for very young children or for disabled or frail adults because their average expenditures diverge considerably from those of other households. And that's become a particularly big policy issue in the US with discussions of how childcare prices have risen much more rapidly than the overall rate of inflation. And the same thing is true for the care of elderly household members. So those are my thoughts about the importance of thinking about a better measure of what it is households are actually producing. Something that really benefits society as a whole is really crucial to our social process of social reproduction, and that can't be captured just by taking the number of hours and multiplying it times the wage rate of a housekeeper or the opportunity costs in paid employment, because it's producing something that's very person specific, that's very unstandardized, and is really contributing to the production of what we value most, which is ourselves and our own capabilities. Thanks.
Thank you so much, Nancy. That was well in time. We'll move to Misty now.
All right, everybody hear me? And can you see my... All right, awesome. Thank you so much for allowing me this opportunity. And as always, it's extremely humbling to speak after Nancy. I am here with my 8 minutes to talk to you about the Care Board, which is a project. So I will say I spent 12 years in the US federal government in statistical agencies, working on the teams that develop poverty statistics, inequality statistics, et cetera. And I'm now at the University of Kansas. And so when I came to the University of Kansas, I wanted to develop a dashboard of economic statistics as if they were developed by caregivers instead of the economic statistics that we all know and love today, which were prominently developed by older white men in the 1940s, post World War II. So that is what the Care Board is. I encourage and invite all of you to go to the site. It's thecareboard.org and take a preview of it. There's an introductory page here with a bunch of links and our funders who support us. There is a page here that talks about what is the care economy. And again, this is really thinking about statistics on the economics of care from the perspective of care providers. So we commingle a lot of data in our statistics that has to do with time spent on both paid and unpaid care. And so if you were to, I won't go through this story because I probably only have 5 minutes left, but you can read this. What is the care economy is really a story using data from the US to talk about the magnitude of care that's provided in the US on an annual basis, both in terms of paid and unpaid care. We also have a page here where we go in depth on care providers, and we look at men and women. So we divide it up by gender. You can look at it by gender and parenthood status. So this is the average amount of time a person over 18 spends on care-related activities every day. We also have this data at the state level. So you can look at, for different states, how does this data break down? And you can focus just on paid or unpaid care or all of it together. Then there's a page here on the distribution of care. We have generated some indicators, kind of macro level indicators for the US, looking at inequality in care provision. So we've developed this Gini coefficient for care, and then a care ratio, which just looks, it's like a dependency ratio in a sense, focused around care. And again, you can look at that for one particular state. This is for California. You can look at it for the entire US. You can click on the trends and you can see the yearly trends over time, whether or not these inequalities are getting bigger or larger, or smaller. We also develop data on sandwich generation individuals. So people who are caregiving, providing paid and unpaid care for children and elderly at the same time. And then we have this broader impacts page, which essentially on the left-hand side, these are all more of your traditional formal statistics we're used to seeing. Labor force participation, so people engaged in paid labor looking for jobs. On the right-hand side, it's all the unpaid care that happens in the US on a daily basis. And so we look both at, and here again, you can look at trends over time. Here for unpaid care, care force participation, there's 155 million individuals doing unpaid care, at least 3 hours or more of unpaid care a day, 62% of all adults. You can look at whether that's gone up or down over time, and you can also look by gender and parenthood status. And so we look at labor force, the time spent in labor, we look at the time investments, and then we look at the economic impact for the US. So, the economic value of paid care in the US is about $6.1 billion per day. The economic value of unpaid care in the US is about $10 billion per day. So it's larger. And again, this right-hand side is the side that's often invisible in the statistics, formal statistics. This is a lot of information. I probably maybe I guess I have 3 minutes left according to my time indicator here. This is great. But we do have a methodology page for if you're interested in how the sausage is made and how we develop these indicators. We're completely transparent here. We use, at this point, only public use data. So we do have this methodology and data page where you can, read more about our methodologies and the assumptions we made, for example, in discussing in the page on provider diversity, or the data on shaping the care provision. You can look here at how we made these estimates and what kind of assumptions we made. We use current population survey data and time use data primarily for our statistics. And then we also have a GitHub. So if you want to download this data yourself, if you want to look at the original public use survey files, you can click on our GitHub and we have all the data available here. Every time we renew and refresh the data on our dashboard and put new data up, we do put our previous versions in previous versions folder. So depending on when you downloaded the data, if you ever need to go back and look at what prior version of data was that you might have downloaded because you have questions, you can go to that folder. And you can see here we provide really detailed information. We give you all the statistical tables for the data that's on the website or on the dashboard. We provide you our data crosswalks that we use to develop some of our data around what type of job is a care job. And then the underlying microdata that we use, again, all public use files, you can find that as well. And our code for developing the indicators, the Gini, the care ratio, and also the replication data. So I will probably, the one other thing that I want to point out to you, since I just have a teensy bit of time left here, is up on the top right-hand side, you can click on About, or you can click on Blogs. And if you click on either of those, it'll take you, it's our same project, but it's the University of Kansas website. But we run a blog series here, and so you can go to our blogs and you can read any of our blogs. Again, all of our data and all of our focus in our blog series and what we write and in the data we produce has to do with understanding the economics of care from the perspective of a care provider. And so the attempt is to incorporate all of the invisibility that exists around what it means to be a care provider in our economy and make it visible and fold it into all the statistics that we rely on a daily basis as a society to function.
Thank you, Ms. T. Thank you. That looks like a very useful tool. Thanks for that. We'll now move to Sergi. Maria, would you be? Yeah.
Thank you very much for inviting me. I'm going to share now my slides. I hope you're able to see it. Can everyone see it? Excellent. So this really picks up from what Nancy and Misty talked about. Data and data-driven ideas matter, but their diffusion from ideas to data-driven actions can take years or even decades. So I'd like to share with you some thoughts on this topic in terms of how the data, such as time use data and others that measure the care economy, impact policy. And I'm going to use some of the work done by Data 2X. Here is a very simple diagram of how data affect policy. There's the direct effects, in which data can have an instrumental role in changing policies to monitor progress in implementing policies and evaluating them. Or it can be indirect, and that is data affects the understanding or conceptualization of policy issues, thereby influencing policymakers' views as well as the discourses among stakeholders. In other words, it broadens the policy horizon. That said, the impact has been mixed. For the most part, time use data has been underutilized in many countries, even though they've collected them, and has been underanalyzed. And to some extent, it has some direct impact in some countries, but mainly to shape social policies. This is the case of South Korea, where the uptake of time use data has permeated both national and local government levels. For example, it had direct influence in the government's third gender inequality basic plan and the third and fourth basic plans for low fertility and aging society. It has also been taken up by local governments in terms of estimating how much should the grandparents' allowance be. So, but for the most part, it has yet to move beyond coordinating women's agencies and social ministries to other relevant ministries such as labor ministry, finance, and planning. Now, that said, the question I have is the challenge in creating the conditions so that care data, including time use data, are used to inform and evaluate policies, where Data2X has actually come up with a report examining the experiences of 4 countries. But I will focus on 2 of them and share lessons from the experience of Mongolia and South Korea, because both have rich experience in collecting time use data. Each run 5 national time use data, Mongolia since 2007 and South Korea since 1999. Well, this is some of the lessons we have learned in reading their experience, in looking at their experience. First, you have to have conducive international environment, and we do have that now compared to 30 years ago. The concomitant recognition of the importance of women's unpaid work and measuring it gave the push for what we know now in the having it entered in the SDGs, and as well as motivating the UN-led data revolution. But it also requires conducive political environment. For example, South Korea has huge demographic challenges, a rapidly aging population and declining fertility rates that created an urgent need for policies that support work-life balance, hence interest on women's unpaid work. There was also public change in public attitude on care provisioning that shifted gradually but steadily from being primarily a family responsibility to being a shared responsibility between the state or government and the family. That said, there are 3 other factors that we seem to be very important. Alliances between National Statistics Office, researchers, and advocates in civil society organizations, and also the importance of an evidence-based culture that provide the richness of the time use data analysis. There has to be also a link between data users and data producers. And finally, and this is very clear both in the case of Mongolia and South Korea, the inclusion of users and stakeholders in the design and analysis of time use survey. I'm going to move on in the interest of time to another area which I'd like to talk about, that is improving our understanding of the care economy and the role of specialized care surveys and fieldwork. Now, I'd like to provide here some knowledge gaps on the care economy. Even though time use data exists now in many countries, they do not provide sufficient information about the care economy. There are still many gaps in our knowledge about it, in varied contexts and settings, care arrangements, the quality of care, the experiences of unpaid and paid care workers in various settings, including community-based informal setups, the demand for care services, because the details matter, financing care infrastructure, and also understanding the impact of climate change. So in this section, I'd like to discuss other tools to consider: national care surveys, the specialized care surveys, especially in targeted areas which tend to be, not really represented in national data sets, like indigenous communities, rural communities, urban informal settlements. My visits in Kenya and Senegal told me the importance also of understanding division of labor within polygamous households, which are prevalent in rural areas, nomadic households, such as those in the steppes in Mongolia. I also want to highlight here the importance of qualitative interviews. So what can innovative data reveal? So I'd like to start with my first example, drawing from the work of the Care Work and the Economy project that I led while I was at American University. I'm going to share only 2 examples here in the interest of time. The first is caregiving and working conditions in South Korea, understanding the care workers' perspective. The motivation here came actually from the qualitative interviews conducted among paid care workers in various settings, both public and private institutions in South Korea. They mentioned about the quality of their workers' commitment, that it could actually vary from setting to setting based on their working conditions. And so to the extent that workers' commitment is a component of quality in care, this paper is motivated to better understand the relationship between the level of caregivers' commitment and their working conditions. And it used a special paid care workers survey data collected by Gallup Korea in 2018, along with the qualitative interviews that were conducted also at that time. Just to give you, it's now published in 2023, but I'd like to share the main findings. Long working hours, long commute time. This is South Korea, after all. The traffic is very bad. Inadequate training, job insecurity, and difficulty in dealing with recipient family members can adversely affect a worker's level commitment.
Maria, you have 1 minute left.
Final slide. I'd like to share the example of care of older adults in urban Colombia, which is based on a 2024 Care Economists in Context study of carers of older persons in urban Bogota. Well, some of the findings here are very interesting. First of all, long-term care is a central organizing force in the lives of carers. In the case of Colombia, it's predominantly, as in other parts, it's predominantly women. They're highly vulnerable. Many of them are economically inactive, and those that are employed are in informal work because dependency is progressive and there is structured in unpredictability so that many women and men turn to informal or temporary employment. The intensity of care work is immense. There's a lot of multitasking and fragmentation of work. And passive minding, which Nancy has been talking about, is a very important component of long-term care. Care arrangements, the importance of extended family care support. Access to paid care has been limited due to finance, to distrust of institutions, and also social norms. And so, and also the financing of paid care services, which is expensive, especially for low-income household, is through collective financing, meaning the pooling of money among different family members. So here are just some examples of the valuable insights that you can get from specialized care surveys as well as qualitative interviews. Thank you.
Thank you so much, Maria. Actually, this is very, very helpful and very helpful, I think, specifically for young feminist scholars to consider some of these care surveys. So thank you for covering that part. Thank you to all the panelists for very insightful presentations. I have a couple of questions here, but I would first like to open the floor to the audience. Please feel free to ask questions to our panelists. You can put your questions either in the chat box or use the raise hand function, and Michaela will call you. You can unmute yourself at that point. In the best interest of time, I request that you keep your questions brief so that we can get to as many as possible. I think how we would like to structure this would be to first take questions for group 1 on research and methods for about 10 minutes, and then we'll move to the data infrastructure and survey. So those who have questions to group 1, please feel free to put that in the chat or raise your hands. Sorry, Ashima, Prof. Maria, you're still sharing your screen. Okay, there we go. Thanks.
So it's satisfying to know that
Questions?
we've answered all the questions.
There are no
Maybe I
questions.
could have given. Any questions, anybody? Or we would just probably shoot our questions then. Okay, I see a hand raised somewhere.
Emanuela, please go.
Thank you. Thank you, everybody, for such a really interesting session. I think, Maria, the question I had to you is just on the recent work you did, looking at the different policy drivers. I think you called them motivations for time use data. did you see a distinction between the motivations? Because I think in some ways that might also determine the type of data that's made. And I'm just wondering if you could say a little bit more about that. Thank you.
Well, the motivation can actually be from outside. There's a top-down approach. For example, the role of international agencies have played a very important role even in the collection of time use data in many developing countries. That certainly is the case. But for the two countries which has collected, several time use data already, although the role of international agencies at that time, UNIFEM, for example, in UN Statistics Division, played a role, particularly in the training on the time use data collection, much of it has been on the burning policy questions that are confronting the government at that time. Let's take the case of South Korea. South Korea obviously we know of the declining fertility rate alongside aging population, but the government did not really confront this until the late 1990s, when it was clear that they're following the path of Japan, and even at a faster rate. And so there was this kind of scrambling in terms of, well, maybe we have to address childcare, but what do we know about childcare? Oh, and long-term care, what do we know about long-term care? Hence the collection of the time use data. In the case of Mongolia, it's very interesting. They were already shifting from being a socialist economy to a market economy, and there was a need for general information about the population. And interestingly, and I think there was a role also played by the UN agencies there, they started to collect also data on time use. But I think what's important here, in my view, looking at the experiences of several countries, is that you also need very rich culture of data analysis and researchers. So researchers, civic society advocates, the national alliances of stakeholders that put pressure on the government. And you need to pay attention to these questions. You need to pay attention to these issues. You need to collect data to be able to, for us to be able to evaluate the impact of policies on this. So I think that plays a very important role.
So there's a question in the chat, and then I will give the floor for Emmeline, so we can answer both questions at the same time, so we can go to the next group. In the chat, they are asking specifically for Nancy, how can we think about old elderly care as a public good, because it's easier for childcare?
This is a really great question, and I think it reveals the way we've all been hoodwinked and tricked by human capital theory to thinking that we can only measure the contribution of quote unquote investment in human capital in terms of future earnings in the labor market, instead of thinking about either the intrinsic value of human capabilities or the importance of maintaining human capabilities as we age, or the tremendous contributions that elderly people make to the care of others, including the younger generation. So I think we kind of need to build on that language of human capital, but we have to reject its emphasis on market earnings, or the future discounted value of market earnings as our measure of what we're reaching for.
Thank you. Please, Emmeline, you can do your.
Thanks very much. Calling in from the UK. I have two questions. I'll try to be really quick, one for Özlem and one for Nancy. And Özlem, I was just wondering, how receptive have the neoclassical economists who you're targeting with your work in different financial ministries been to, the contributions and different perspectives of gender-focused economists like yourself? I'm curious about that. And then Nancy, I'm curious, you spoke a little bit to this in your last response, but really thinking about how we can shift conceptions of care towards more of an idea around investment, but also public good. As I'm a PhD researcher right now, and I'm curious, how do we go about doing that work? Is it sort of a linguistic thing that we focus on? We focus on talking about care in a different way? Or are there other sort of methods that care-focused researchers can think about, really challenging and rejecting some of those ideas you mentioned?
Who should go first here?
So I think Özlem can answer, and then Nancy, and we are receiving questions for both groups, so feel free to ask it in the chat or raise your.
Thank you so much. There is also a question in the chat that I was having an eye on, but I'll let Michaela give the word to respond to that last question or not. Thanks, Evelyn. It is work in progress and very frustrating to talk to mainstream economists trained in Ivy League universities, be it academics or civil servants or think tank economists. So the practice is a daunting amount of work. I continue to try to talk to them, but I'm not naive. I know that we will only be heard, or the kind of findings we are presenting will only be used if two things happen. I try to communicate with progressive activists, movements, parties. If they get to power, they will be the ones who can make use of these kind of policies. What we are doing is to prepare the ground, give ammunition, but also give self-confidence to these progressive people, because they're themselves very much restrained in their imagination. They're very scared, very timid in terms of using this kind of research, all attacked day in, day out by mediocre journalists, mediocre civil servants, mediocre academics. The second thing that I am working on is to train a new generation of civil servants that's patient, long-term, maybe a couple of decades of work. But obviously governments, when they come to power, if they don't have civil servants to lean on, or people whom they can appoint, if it is a country like the US, who know how to implement policies, who know how government apparatus work, they're not going to be able to run against this mainstream current. So hence, I'm not frustrated if the kind of articles we write don't get published in mainstream journals, or are not presented. They are even canceled in mainstream environments, or at best they're ignored if they're trying to be polite. But it's not putting us off. We are doing the best we can do, but be part of the movements and trying to really work with them. Learn from them, but also train them. Learn from them in terms of what their needs are, what the questions are, what the attacks are. Learn from them how we can better communicate our findings in simpler human language, but also really educate a new generation of activists, policymakers, and civil servants.
Nancy, you can answer.
Yeah, I would start by saying I do think it is partly a linguistic, a cultural, and a.
I don't hear Nancy anymore.
Nancy, you are mute.
So sorry. I do think it's partly a linguistic and cultural and kind of moral watershed, thinking about the distinction between consumption and investment. But I also think the language of environmentalism and of public goods and externalities is really helpful here. And care provides pretty significant fiscal externalities. That is, if you think about the way in which most states organize the finance of healthcare and elder care, they're taxing the younger generation to provide services to the older generation. But the net benefits are especially high for those who haven't put time or energy into raising that next generation of taxpayers. So there's a whole accounting project called the National Transfer Accounts, looking at how we have socialized the benefits of care provision more effectively than we have socialized the costs. And it's a very direct analogy to what we think of as the causes of climate crisis. And I think we also, beyond the fiscal externalities, we could also be really emphasizing the social externalities, the vital importance of establishing trust and concern for others as a precondition for effective cooperation in solving public goods problems. And care provision plays a really crucial role in developing those social capabilities.
Thank you. We still have some time to answer a couple more questions on the chat. There is a methodological question and also a very theoretical question. I will start with the second one. It is a question that relates the care infrastructure spending with the equity of the public pension system. So if anyone there wants to answer, what extent can public spending on care infrastructure by increasing women's labor force participation, reducing gender wage gap, and improving lifetime earnings strengthen the financial sustainability and equity of the public pension system? And also, if some of the speakers want to address another question that says, using the National Time Use Survey data, is there a good statistics measure or method in order to classify nuclear or single couple households based on the couple's individual time use into, say, gender confirming deviant and egalitarian households? Özlem, you want to answer?
I was interested in Emre's question, which gave it a very nice angle, linking it to pensions, because it's another financial sustainability problem in aging populations. We often talk about the need for care investment in the context of demographic change, not just in advanced capitalist countries, but also in emerging economies and even low-income economies yet to come. Of course, that has then implications for the pension system as well. Now, the issue of care deficit means that women are now choosing not to care. Not to care also means not to give birth to children. So fertility and care deficit are very clearly linked issues, meaning labor supply endogeneity and productivity endogeneity on the supply side that comes from feminist macro models is not just about hours of labor supply or the quality of that labor supply, but it's also demographic population growth implications, particularly when we look at countries like Korea. A new generation of young women are either deciding to emigrate, to escape the environments like Sergi was talking about, the daunting amount of care load that they would have to carry otherwise, and or at the same time they're deciding not to have children. So that's not going to make my pension very viable, is it? And it's definitely going to create issues for public pension schemes. So any government who is thinking for the long term should think about care infrastructure provision. The related question to that is, of course, old age pension poverty, which is a particular issue for women living longer, despite the fact that women have higher savings rate. There was another SFC savings rate differential between men and women question in the chat. Yes, there are models, and there is a difference between the savings rate of women and men. Women tend to save more but they also earn much less. And they without public pension schemes, their ability to speculate and save in private pension funds and financial assets is a lot more limited. So that brings then the issue of who is going to take care of those women in old age, in poverty, without adequate pension provision. This is going to come back and become a budgetary problem for the governments as well. So there are so many angles a long-term thinking government should take serious about the care infrastructure provision, that we should really bring all of them together.
Does someone want to answer the one of the single-headed household? Maria?
Could you repeat the question? I just want to make sure I understood it very well.
Yes, the question is a methodological question, and it says, using the National Time Use Survey data, is there a good statistics or measure in order to classify nuclear or single couple households based on the couple's individual time use into gender confirming deviant or egalitarian households? And the suggestion is, one way we thought was using the share of each partner's time in unpaid work relative to the overall household unpaid work burden.
Well, I'll answer this question just looking at various types of time use survey. First of all, there's no harmonized way, there's no harmonized methodology in collecting time use data. Different countries collect it different ways. In some countries, for example, the case of Canada, it's one respondent per household. So you cannot, so you only have one time use data for one respondent for the time use data. That said, the classification of households, whether you want it like couples household, female-headed household, or extended multi-generational household, will depend on how you will analyze the data. For example, if in the case of South Korea and the project they had in care work and the economy, clearly the dependency ratio and the type of dependent mattered. So we classified household not so much on who's the head of the household per se, but more in terms of whether the households have children or not, have dependents with older adults or not, and so forth. In the case of Canada, the classification that we're interested in under the care economies in context is looking at it by urban versus rural and indigenous versus non-indigenous groups, because there are the indigenous Canadians have a particular way, and also and we are also looking at it at the provincial level, because Quebec in particular, for example, has universal childcare since the 1990s. And it's only recently that the other provinces in Canada have adopted it. So that will affect also the time use patterns of those households. Anyway, I hope I answered that question.
Any other comment relating to those questions? Thank you for your answers, and thank you, Özlem, also for addressing the one on savings. Unfortunately, it is time to wrap up the Q&A, but if you still have unaddressed questions, I see there are some of them in the chat related, for example, to the how useful these surveys are in Global South context. Maybe you can share them with us in the chat again, and we will be happy to compile them and share them with the panelists. So now, Ashima, if you want to go. Yeah.
Yeah, thank you, Michaela, for doing that. And thanks for giving some time for last reflections. I'll now invite each panelist to share their final comments or any advice for young scholars and budding feminist economists, what they should be keeping in mind in terms of advancing research on care economy, as well as keeping in mind in terms of data and surveys. So less than 1 minute, but just a very quick go around the panel, please. Thank you. And less than 1 minute for each panelist. So we have like, yeah.
Shima, in which order are we going?
I think we can start in the same order. So Ajit, maybe we can start with you now.
Okay.
Yes.
All right. Well, I think I listened to very interesting questions, which I've learned a lot from these questions and thinking about these issues. Um, I think the points that Nancy made are particularly important about divesting or actually disassociating the investment in care as something that's, return bound, some discounted value of some future benefits, monetized benefits that you would receive. And apart from the public good, I would say also there's a question of rights. In fact, in the United States, there was a welfare rights movement which demanded that as a part of social rights. So it's also related to social citizenship rights, and we should articulate it that way too. In terms of the financing of care and the kind of care arrangements that are emerging in the fields of care, we have to keep in mind the role of private equity and the way that they're seeing opportunities. And like if you think about the markets now in the US, the number of elderly people with ADL or IADL difficulties amount to about 18.5 million people. That's exactly the same number as the number of people who are in the 0 to 5 age group. So it's a very sizable population. So we have to think about the care economy and the way that this is seen as profit-making opportunities via outsourcing and contracts. So this is something we have to pay careful attention to, I think. I'll stop there and let Tom take over.
Thank you.
Unmuting. Okay. Yeah, this was a great session. Too much probably to digest and reflect on in less than a minute. It seems I'm always kind of pessimistic, and it seems to me like we're in the middle of a debate about whether or not public goods are a thing we should want, rather than what kind of public goods we should be pushing for. So it's a little depressing in that way. Yeah, I think if we're going to urge young researchers to do anything, I think it's to fill in the gaps in information between the kind of public use data available in terms of time use and income, and the actual experience of people who are getting access to care through public sources, etc., and their time use. That's a very selfish request on my part, but get to it, please. Thank you.
Thank you, Özlem.
Yes, my advice for us all moving forward would be to enlarge our sphere of influence and synthesize, pull the strings together, make care a core component of, for example, ecological macroeconomists. I would be very interested in being part of a new team of people who are doing feminist, ecological, post-Keynesian macro modeling, bring climate, green economy, and care economy together. The other thing I am interested in, and Michaela at Greenwich, hopefully with us, will be really working on this, to really think about care regimes and how that then has different implications for the macroeconomy, productivity, demographic change. And with care regime, the kind of questions I'm interested in is who cares, the kind of analysis that we heard today, what is the paid versus unpaid and gendered structure of that care work, but also who pays. Is it public provision or private provision? If private, is it formal or informal economy? Is it going in the direction of public provision of care services, or is it taking the shape of cash transfers and baby bonuses? The latter scares me a lot in the context of pronatalism that is now spreading in authoritarian regimes across the world. Obviously, the conditions of the carer, but also the conditions of those who receive the care, the labor market structure of those who are providing the care work. So all these will have very crucial implications for largely the macroeconomic consequences, but also in return, public finances, technological change, pension systems, fiscal sustainability, debt, and all the rest of it. And I dare to say, I also have in mind something that I think of as an optimum care regime. What is an optimum care regime for equality in terms of gender, class, and race, as well as the well-being of those who are providing the care, as well as those who will be receiving the care. In my mind, there is honestly an optimum care regime, and it's not like it depends on culture and it's not one size fits all. I think there is something that is emancipating and equalizing, and feminists should start talking about it, and all of us should start talking about it broadly.
Thanks, Özlem. Not less than 1 minute, but very helpful. Thank you. Nancy, I'll pass on to you.
The second, what Özlem was saying, a better world is possible. Better research can help us move towards it. And so can better survey design.
Perfect. Thank you. Misty?
Yeah, I mean, I would just say to students or younger scholars, believe in yourself. We don't always see ourselves reflected in the dominant theories and the dominant ways that we think about the world. And it's okay to not see yourself reflected in there, but at the same time, we should focus on centering what we want to see in the future around our own realities. And the more that we do that, and the more that we stick together in doing that, the faster and the better we're going to be able to move forward towards change that's more accurately representative of all of us.
Great. Maria, passing on to you finally.
Ideas matter, and data-driven ideas matter a lot. We need to use our creativity and innovation to push for quality care for all. Governments come and go, politicians come and go, but the need for care and the provisioning for care will always be there. Thank you.
Thank you so much. Perfect end to this. But thank you all. Thanks to all our speakers for those last reflections, excellent advice, and all the valuable information you shared with us today. I think we're taking away many useful insights, but also leaves us with a lot of thinking about ways to advance rigorous feminist economic research on the care economy. So a lot of thinking involved there. Thank you to all of our attendees for joining us today and for the wonderful discussion. I also want to quickly thank my co-chair, Mary Borman, for helping me put together this event, IFE staff, Wendy and Myra, as well as Michaela for supporting this event. Thank you so much. Also, just one note, please look out for our future IFA online events. Our next event is going to be on December 10th, which will be a fireside chat with Lauren Klein on her book, Data Feminism. Again, as I said in the beginning, please also stay tuned for part 2 of this series on care economy, which will extend the focus to policy space, specifically discussing care policy tools and initiatives with scholars from academia, but also the ILO and UN Women. Best wishes to you all. Thank you for attending. Thank you.
Thanks, everyone.
Thank you.